So good morning and good afternoon, friends. So let us wait for another 3 to 4 more minutes. Couple of other people who already registered are joining. Let's wait for them, and then we will start in another 3 minutes later. Please do wait. Thanks for your patience. So friends, let us start our webinar. So today, this webinar is actually focusing on the International Institute for Global Health report on the access to medicine index. Index. This is one of the study prepared by the IIGHS researchers. This is a part of their larger work program on addressing the inequalities in the global health. So this is part of one of the work program looking at power and accountability in the global health. So this report is part of that larger work program, and as part of it, IIGHS researchers are looking at uh, various this type of indexes, starting with the access to medicine index. So as we all know that in the peak of neoliberalism, there were various initiatives took place to address the relentless march of market. You might have come across this shareholders activism, or the certain activism related to corporate social responsibility. So this is also one of the initiatives, like preparing indexes to rank corporates based on their behaviors, etc. So this was one of those initiatives started in the last decade. So 2 decades ago, actually, in the early 2000, in first decade of 2000. Now, so these are all, in a way, one can view as an initiatives or attempts to tell the public what the behavior of the corporate, and with an intention to um, sort of creating some kind of discipline among the corporate behavior, but it also has its own the other side. So one of the important unintended consequences of this kind of indexes or this kind of initiatives is also that it basically gives kind of a feeling that state's intervention can be minimized because there is a private ordering. This kind of an kind of a private ordering where uh, uh, you know indirectly telling the state, hey, we are taking care of these things and you don't have to intervene. Your intervention is like the last intervention, something like a, people call it as a nuclear option kind of thing. So this is one of the unintended consequences of this types of initiatives. And the second unintended consequence is that it creates a complacency among the actors or the watchers. Oh, there is scores are good, so things are happening. So we don't have to really ask the questions we should ask because these all index shows in a way a very good picture. Depends on the what the index are trying to convey and what kind of score is given. And third consequences, unintended consequence, that it gives an opportunity for the corporate to whitewash their image. They can say, "Hey, we are in, have a very good score in all these index." But having all said this, I did not intend, or I am not intending to say that everything is wrong with these indexes. I am saying that these are some of the unintended consequences with any kind of this initiative. So against this background, always, devil is in the details. So it's important to we understand these index, what are its complexities, and what are the way in which the scoring happens, and much more in a nuanced way that gives us a much more an informed understanding of the utilities of these initiatives and as well as index. And it also gives an opportunity to reform this index and to serve its real purpose. And against this background, we need to look at this report. So having said this, let me now introduce our speakers and also today's program. So we have two speakers. Start with David McCoy. David McCoy currently serves as the Evidence to Policy Research Lead for UNU IIGH. And prior to joining UNU IIGH, he was a professor of global public health at Queen Mary University, London, where he conducted research and taught on the health system policy, global health governance, and political economy of health. And he is one of the lead lead on the power and accountability work program. And second speaker is Els Torrels, is a global health equity and medical innovation expert and founding director of AIQA, a think tank on equity and economic justice for health. And she's trained as a bioengineer and PhD from Brussels University, and but having more than 20 years of experience in various organizations on access to medicine related issues, including I think all spectrum of access, starting from R&D to the last mile access issue. So David will present the report, and then we will hear from Els Torrels on her reflections on these initiatives as well as from the report, and then we will open up the floor for discussion. David, floor is yours, and please go ahead.
Great. Thank you, Gopa. And Gopa, you forgot to introduce yourself. Because I think it's important to say that you work for Third World Network, a very important NGO in the health field, and an NGO that has done incredible work, important work in the area of access to medicines. So just wanted to acknowledge the work that you and TWN have done in the past. So let me begin by just saying a couple of words about the United Nations University and the International Institute for Global Health. We are actually not functional as a conventional university. We're described as a university, but in fact, we are much better described as a network of think tanks that was founded in order to be able to act as a bridge between the international academic community and the UN system. The university itself was inaugurated in 1975. It was headquartered in Tokyo. And unlike some other UN agencies, it's not governed by member states, but rather governed by an independent council. And the idea is that United Nations University would operate and act as an independent academic arm to the UN system. And over time, since it was established in 1975, United Nations University has now grown into a federation of about 14 institutes. Each of these institutes is focused on a different topic. One that I belong to is based in Kuala Lumpur in Malaysia, and our institute is focused on global health. Just very briefly, wanted to say that we launched our new strategy at the beginning of this year. The strategy is focused very much on the issue of reducing health inequalities in global health. And within this broad strategy, we have 4 work packages. One on gender equality, a second on digital health governance, a third on climate justice and health, and a fourth on power and accountability. And this work on the Access to Medicines Index falls under the Power and Accountability work package. And within that, we've been looking specifically at the power and accountability of powerful private actors. And one of those types of powerful private actors is the transnational corporations that now exist across multiple markets and economic sectors, and which have an important impact on health and health inequalities. And you will see here a reference to a report from reference to a working paper which provides some background to this program of work, looking at the challenge of holding powerful actors to account within the broader system of global health governance. So that's just a little bit of background. And as I mentioned earlier, we have a particular focus on private sector actors within the field of global health. So, I mean, Gopal, you've talked a little bit about the importance of transnational corporations in the world today. We've seen them grow in size and power across a range of markets and sectors. And in fact, you know, there's good evidence showing that across multiple markets and sectors, we're seeing increasing oligopolization, with dominance of a relatively small number of transnational corporations in these markets and sectors, including the pharmaceutical sector. There's a growing body of academic literature that's being produced, describing and measuring the commercial and corporate drivers of ill health and showing just how substantial these impacts are. And increasingly, there's been calls to try and address this issue, to try and minimize the harms of transnational corporations, recognizing, of course, as well that private sector actors do produce technologies, commodities, and services that are beneficial. So it's really a question of how we minimize the harms and maximize the benefits. And one approach for doing this has been to encourage more ethical and responsible behavior by transnational corporations by setting up initiatives that effectively assess and measure corporate policies and practices according to a selection of indicators. By then assessing and measuring these corporate policies and practices, a composite index of performance may be established, and this can then be used to rank corporations against each other, effectively creating a league table of corporate performance with those corporations that are performing well according to these indicators, scoring highly and ranking highly in these league tables, and those that are not performing well, scoring and ranking lowly. And the idea is that by creating these rankings, by creating these league tables, we'll create a system that will incentivize transnational corporations to improve their policies and practices in order to be able to compete for higher rankings. And the reason why they would do this is because they would want to be seen to be more desirable to work for. They would be seen by investors to be more desirable to invest in, and by business partners. These would be corporations that would be more desirable to do business with. And the idea also is that other stakeholders can use these rankings to hold transnational corporations to account. These might be public stakeholders or civil society stakeholders. So that's a bit of the background. Just want to say a little bit about the Access to Medicines Index, which was established in 2008 by the Access to Medicines Foundation, a non-profit organization that's based in the Netherlands. And the way it works is to rank the 20 largest pharmaceutical companies globally. Now, all of these companies are currently research and development companies. They do not include generic manufacturers, although initially they did, but they were removed from the index in 2012 because of the difficulties of comparing generic manufacturers with brand name manufacturers. And the aim of this index is to assess the performance of these corporations in terms of improving access to medicines and other products in low and middle income countries. The index is currently endorsed by various prominent global health actors, including the World Health Organization, and it's also highly promoted, particularly by those companies that are highly ranked. So in our effort to assess the Access to Medicines Index, what we did was to essentially review 8 of the Access to Medicines Index reports that have been published since 2008, and their associated methodology reports, as well as relevant pages on the Access to Medicines Foundation's website. We also searched for evidence of the effectiveness and impact of AtMI, and we subjected our report to peer review. And we also invited the ATMF, the Access to Medicines Foundations, to comment on our draft report and to provide further information and correct any mistakes that we may have made. But that invitation was declined, so we did not get feedback from the Access to Medicines Foundation. Now, this report has just been published, and it's available on our website. But what I want to do is just take you through some of the key highlights from our assessment and analysis of this report. The first thing is to mention some points about the governance and funding of the Access to Medicines Index. This is a list of the funders, which include bilateral aid funders, include funding from private foundations, and it also includes a couple of funders from the world of private finance as well. The index is relatively well funded. In 2022, the expenditure for the index was 3.6 million euros, 75% of which was spent on the salaries of about 40 staff. So there's quite a large number of people working on producing these indexes every 2 years. And there is a supervisory or advisory board that helps to govern this The production of this index currently made up of 6 individuals with a wide range of current and past affiliations. Now, in terms of the methodology, the index, although it's called the Access to Medicines Index, it actually covers 8 different product types: medicines, microbicides for HIV, vaccines, diagnostics, vector control products, contraceptives, and a variety of different platform technologies. So it's much broader than just looking at access to medicines. It currently covers 83 selected diseases, pathogens, or conditions affecting low and middle income countries. These have increased from 24 to 83 since the Access to Medicines Index was first established, and it currently is looking at products that relate to 23 communicable diseases, 18 non-communicable diseases, 20 neglected tropical diseases, 10 reproductive, maternal, and newborn health conditions, and 12 priority pathogens. And when we're talking about access in low and middle income countries, the number of countries that are involved in the index has increased from 88 to 108, as it was in the most recently published index. Now, the way the index works, the way it's structured, is in terms of 3 technical areas, 14 priority themes, and within these are 31 indicators that are used to produce the quantitative measure of performance. So 3 technical areas. The first one is on governance of access. The second one is on research and development. And the third one is on product delivery. Companies are able to score between 1 and 5 according to how well they perform on each indicator. So each of these 31 indicators, companies are given a score between 1 to 5, depending on how well they perform. Indicators are also weighted, and therefore the technical areas are also weighted. And you can see the weightings in this column here on the right side of this table. And then the individual scores, the individual weighted scores, are then combined to provide an overall composite score out of 5 for each company. And it is this composite score that is then used to rank the companies in a league table. Worth noting that over time, the number of technical areas has reduced from 8 to 3, and the number of overall indicators used to assess the performance of these companies has reduced from 94 to 31, and that the weightings have also changed over time. So this is a methodology that has been evolving since it was first established. In terms of the data that is used, most of the data is obtained from companies via self-completed survey. Reportedly, the data that is submitted by companies is verified, cross-checked, and clarified. And this is why that the AtMI also report that some data is sourced independently of the companies from a variety of places, including the US Food and Drug Administration, the European Medicines Agency, Health Canada, and also from WHO, other multilateral organizations and NGOs, although it's not specified exactly what data is sourced from these other sources. The data is eventually used to calculate the score for each indicator. That data, the final data set that is used to calculate the score, is not available publicly, and this means that it's not possible to replicate the score that the AtMI use. So there's no way of independently verifying the scoring using the same data set that AtMI use. So that's a concern about the transparency of this process. Just a word to say that the methodology is reviewed and updated through a systematic process and involves quite extensive consultation with a variety of different stakeholders, including donors, intergovernmental organizations, low and middle income country governments, NGOs, academic institutions. So there is both a process of in-house review of the indicators as well as stakeholder engagement in order to refine and hopefully improve the methodology for assessing the performance of these different corporations. So as you can imagine, it's quite a complex methodology. These are the 31 different indicators with their weightings here on the right side. And each of these indicators is in the methodology reports of AtMI described in terms of how the scoring system works. So not possible to go through all 31 indicators here, but just to give you a sense of how these indicators work. You can see here with one of the indicators on governance, the governance technical area. One of the indicators is set up to essentially assess whether companies have an access to medicine strategy and whether companies are able to demonstrate that this strategy is integrated within its wider corporate strategy, and that there exist well-integrated strategies to improve access to medicines across the company's portfolio and pipeline for those diseases within the scope of the index. And here you can see the the scoring guidelines that are used to score maximum 5. The company has to have a clear strategy with evidence of alignment with its broader corporate and business strategy, and to show that there are measurable objectives to improve access to medicines, and to be able to show evidence that the strategy is applied across the company's portfolio and pipeline. And different gradations of you can see that the scoring system goes from 5 to 0, with companies scoring 0 if it neither has a strategy nor any commitments to improving access to medicines. So this is really an indicator that assesses a company's strategy and its commitment to improving access to medicines. But the actual quality and relevance of the strategy itself is not assessed. Rather, it's an assessment of whether the company has a policy or a strategy in place, but no actual assessment of the quality of that strategy or of that policy. And in terms of the most recent index, what AtMI were able to report is that for the first time, all 20 companies report having an access to medicine strategy with measurable objectives, and that 19 companies have integrated this strategy into their wider overall corporate strategy. In another example, we have an indicator assessing a company's R&D pipeline in terms of priority diseases, and this is an indicator measuring whether the company engages in the development of products that target priority gaps identified by global health research organizations, including the existence of innovative and adaptive R&D and in-house and collaborative R&D, again for these particular products that are within the scope of the index. And here you can see in the scoring guidelines that are published publicly, this is all that we could draw out from the literature that's made available, that simply what's described as scoring guideline for marks between 1 and 5 is simply something around the total size of each company's priority R&D pipeline scaled across all companies, and that this is then scored. But we don't know exactly how the scoring system works. And all we know is that if a company has no projects at all in its research pipeline, they get a score of 0. So I'm going to just rush through the next couple of slides, and rather than go through them in any detail, simply say that in the report that we've published, we've gone through an exercise of assessing each of the different 31 indicators. We've made a comment in the green box here, which you'll see in our published report, a comment on what we think about this report, of this indicator, whether it's a strong or effective indicator of company performance. And we've also provided a summary of what was found from the most recent evaluation of these 20 companies that are covered in the index report. And we've done this, as I said, for each of the 31 separate indicators. This table here presents the findings from the last report. So these are the 20 companies that were evaluated, and the ranking and score of each of these different companies is shown here on the right-hand column. This is organized by the size of the 20 different companies, but you can see here on the right side, GlaxoSmithKline with the most recent index was ranked number 1. Ranked number 2 was Johnson & Johnson. Ranked number 3 was AstraZeneca. And what you can see over the last 8 reports that were published is relatively consistent findings in terms of the top 5 or the top 10 companies that are scored by this index, and relatively little change in terms of the composition of the top 20 as well. Although over time there's been a number of mergers and acquisitions as well, so that the list of the top 20 companies has changed slightly as a result of that. So what's our overall conclusion about this particular index? I think the first point to make is around the issue of data and transparency. As I mentioned earlier, most of the data that is used is provided by the companies themselves. Although AtMI do make an effort to verify this data, there's a lot of data that is simply very difficult to verify because there is no way of independently verifying them. There's a lot of data that is not publicly available, and the final data set, as I mentioned earlier, is not made public, so that there's no way of independently verifying the scores that are finally produced. The second broad comment that we make about the 31 indicators is that they represent relatively soft and friendly indicators of corporate performance. For many of the indicators that are used, it is relatively easy for companies to score highly. So looking at these 31 indicators, one might conclude that these are standards that are relatively friendly and soft as far as holding these corporations accountable to standards that one would want to see in order to be able to improve access to medicines in low and middle income countries. The third is that there's actually relatively little evidence that these indicators have actually improved access to medicines in the real world. We can perhaps show that the index has helped to change policies or helped to incentivize companies to establish new policies related to improving access to medicines. But whether or not those policies and those strategies and those changes in behavior, as determined by the 31 indicators, whether or not they have actually then resulted in improvements in access to medicines is questionable. And of course, there are many other initiatives. There have been many other actions by civil society, by governments, and by other actors to improve access to medicines. And it's very difficult to be able to attribute any improvements in access to medicines to one or other of these different factors or forces. The final thing, or the fourth thing to say about the set of indicators, is that there's a relatively narrow and focused scope on the production of medicines and on those diseases and products that are described earlier. But what's not covered by the 31 indicators are a variety of other corporate behaviors. And this includes, for example, financial conduct of these corporations. So we don't, for example, through this index, measure the conduct of corporations in terms of responsible tax behavior, companies behaving responsibly in terms of paying taxes and not engaging in tax abuse or unethical forms of tax avoidance. And also, probably the most important thing is that the index does not adequately measure and assess corporate behavior in terms of political lobbying and in terms of unethical marketing as well. And then the final thing is really just echoing on what Gopi was mentioning earlier, that this is an index that looks specifically at corporate behavior. And it's an index that also just looks at the 20 biggest transnational corporations. It does not look at the wider pharmaceutical system or sector as a whole. And it is not an index that can be used to assess the adequacy of regulation of the pharmaceutical sector, and therefore not an index that really is focused on shifting or having some structural transformative effect on the pharmaceutical sector as a whole. So it's relatively narrow and limited in that regard. And so for that reason, one of the things that we've done at IIGH is to convene an independent expert group to re-examine our own report on the Access to Medicines Index and to reconsider its benefits, its strengths, but to also look at its limitations and its weaknesses, and to propose some recommendations as to how we may be able to hold transnational corporations more accountable and more effectively, and most importantly, in a way that can also catalyze the wider sectoral and systemic change that's required in order to improve access to medicines in low and middle income countries. And one of the members of this IEG is, of course, Els Toril, and I'm now going to hand over to her to make some additional reflections on the report that we've just published. Thank you very much.
Thank you so much, David. Gopa, can I just jump in, or you want to say a few words?
No, please. Please go.
Do you hear me well?
Yes.
Yes, okay. So thanks so much, David, for this detailed description of what is indeed in the report, a very detailed analysis of this particular tool. And I wanted to focus my comments a little bit on the bigger picture, because why are we doing this, or why are we why is the world creating these indexes, etc., is indeed with the idea that there is a responsibility of these global corporations, and that we want to, analyze that document and hold them to account. But if we think a little bit about what the purpose really is, I mean, we have come to depend on these global corporations, pharmaceutical companies that have become these huge global corporations for essential health tools like diagnostics, vaccines, and medicines. And this is an evolution in the last 50 years that have created this very big dependency of a sector where we all kind of expect that the pharmaceutical companies are there to produce health technologies and somehow so are concerned about our health. But the reality is that global corporations have their own incentives that are increasingly purely economic and financial. And I think that over the past 20 to 40 years has changed quite a bit, where you can see today that companies are driven purely by financial and economic imperatives, and have actually completely lost, if they ever had, this health purpose. And so if we think to hold companies to account for their health purpose, I think we're already kind of making assumption that they are concerned about the health purpose. And in my view, and I think increasingly, this can be challenged. If you think about, for instance, how they choose R&D priorities, this is not based on unmet health needs or priority health needs. We have, for instance, antibiotic resistance, which is a major need, and companies don't feel that they have a responsibility to actually address that need. And again, we're not talking low and middle income countries here. It's just the business model of the current global pharmaceutical corporations. It's not driven by resolving or being good for health. And so if we then think that this is for even in high income countries, which are representing probably 80% of the market of these companies, if we then think that we need to hold them to account for what they do for the health of people in low and middle income countries, I think we're kind of then assuming that that must be just corporate social responsibility or some charitable response of companies, because it's so far away removed from the main corporate purpose of these companies. But that's where we have a problem, of course. Like, how have we come to rely as a society for our essential health tools on these global corporations, knowing and increasingly being documented today that all the drivers that drive the behavior of companies are about increasing financial return, not even for the companies themselves, but for the capital investors and the shareholders of these companies. And so I think that we need to put a little bit into perspective what these very, very voluntary kind of rankings. I mean, the companies couldn't care less, I think, I'm afraid. And this, I think, is a very big weakness. We need to hold these companies accountable for what they are actually doing or not doing for health. And I think that they're, instead of trying to move around within the enormous powers that these companies have, it's clear we need to shift the power. We need to shift the power away, the power over global health priorities, over access to medicines. We need to shift it away from these global corporations, because they are not having health as their purpose. And I was last week in a conversation with the development economist Yahun Chang, and he said in an interview, like, corporations, they function today with their financialization with $1, one vote. That is how the directions are being set of corporations. And it's not about health. And so I think that we need to really think very carefully how we can move the responsibility for addressing people's health needs, which includes affordability, which includes equitable access in low and middle income countries, obviously, but actually not only, because increasingly also in high income countries, we have major issues around equitable access and affordable access to the right health technologies that we need. And so I think that those indexes somehow fit into an idea of the status quo, and accepting that global pharmaceutical corporations are there to drive activities that are good for our health. And I think that is just a fallacy that we need to come to reality with, and then find ways that governments, civil society, the people can take back that responsibility of driving research and development, producing medicines, vaccines, and health technologies for a health purpose, because it's never going to come from these global corporations. And then we need to take away all those very favorable financial incentives that we give to global corporations, including very generous intellectual property regimes, etc., because we think that they are doing something for our health, while in the end, that is not at all their corporate purpose. So I'm going to leave it here to leave time for questions and comments from the audience. Thank you.
Thank you, Els. It was very brief, and thank you, Els. It was very brief but very pointed intervention. So now the floor is open. So participants are free to ask questions or comments. If it's a question, nice if you can tell the person whether it's to be answered by David or Els or both. That helps. So now floor is open, please.
There's one question, Gopa, about whether selected companies include their subsidiaries and business investments if they're involved in the products of interest. And we don't think that's the case. So there is an issue about exactly how these transnational companies are evaluated, because many transnational companies, of course, have very complex structures these days, and exactly how subsidiaries are involved in this evaluation is unclear. And there may also be supply chains that are very important, which are not included in this assessment. So that was a question, I think, from Malini. Thank you for that. Maybe just while we wait for other questions, maybe one other thing to say, just in response to what you were saying, Els, is that it is important to be able to assess, monitor, and evaluate the performance of transnational corporations. So in theory, having an index or having some kind of scorecard can potentially be useful. The problem is that, I guess, if these scorecards are constructed using indicators that are weak or that are soft and friendly to the corporate sector, not adequately strong enough from a public interest perspective, then these scorecards can actually have an inadvertently negative impact, in the sense that they can help to greenwash or health wash these companies and not really hold them adequately accountable to the kind of standards that we want. And in this sense, they can reinforce the power of the dominant transnational corporations rather than strengthening the public or strengthening the hands of governments to ensure that they're behaving in a more ethical and appropriate manner.
No, I totally agree with that, David, if I may. I think it's important to document behaviors. The question is whether documenting it, first of all, as you say, it all depends on which indicators, the level of trustworthiness of the data. But then documenting is important. But then the theory of change, I think, of some of those indices are that then by documenting that they will kind of provoke self-correcting behavior of companies, which I think is taking it way beyond the possibility of the documentation that I agree is critical. And I just wanted to mention there is another scorecard, which is called Fair Pharma Scorecard, that is done by the Pharma Accountability Foundation also in the Netherlands, that takes a slightly different approach to that. But it's again about documenting what companies do. That was specifically around COVID medicines and drugs, which I think is important. But the assumption and the danger, I think, here is that, for instance, all the donors that support these type of efforts are the same donors, which is mostly high-income country donors, that are reluctant to actually drive or allow change. For instance, if we just think about the discussions on the pandemic treaty, where there are demands from pharmaceutical companies to share technologies, even only in the context of epidemic response. And there, the same governments that support the index are very reluctant, if not to say hardly blocking, any actually structural change that would make access and innovation for low and middle income countries more conducive.
Yeah. Gopa, there's another question from Kay.
One more question at the chat. Yeah, please.
Yeah. Would you say the AtMI should be reformed or closed? What indicators would you include in a reform? And is there a better actor to publish this kind of index? So I think the AtMI as it currently exists is possibly, acting more as a barrier to access, to improving access to medicines rather than a catalyst for expanding access to medicines. So I would like to see AtMI adopt a broader set and a stronger set of indicators, particularly in relation to intellectual property, to behaviors around technology transfer. And then finally, for me, one of the big aspects of corporate behavior and conduct that we should be evaluating is around tax behavior, tax payment, and the extent to which there is transfer pricing and tax avoidance, and that's critically important, not just for transnational pharmaceutical corporations, but right across the corporate sector, and the amount of lost public revenue and the illicit flows of finance is a major cause of wealth leaving, in particular, low and middle income countries. And so this is a dimension of corporate behavior that I think should be incorporated into indices, all of the different corporate indices that now exist, not just for pharmaceutical corporations, but also for food companies, for oil companies, etc. There are so many indices now that have been established to look at corporate governance and performance. And then the final point, and maybe else you can also comment on this, is if such an index does exist, how should it be funded? How should it be governed? Who should be managing it? Obviously, producing an index takes a lot of work and effort and takes a lot of data as well. How can we get a more effective index in place? What do you think about that?
Yeah, this is indeed. I think we first need to clarify what we expect the index to do. And again, I'm a big fan for the documentation and the transparency, which is then different than thinking that this will be sufficient to drive any voluntary change, which I think we know enough that it's not going to happen. But then the question is, how do you get access to the data? Because there is the indicators, and I think the report documents very well some of the weaknesses of the indicators, and they can be improved, and there can be a different set of indicators, which I think should also not just make that thing about low and middle income countries as if that is a separate type of behavior. I think we need to think about the global structural role of these corporations. But then how can you, if you do not get actually access and you cannot oblige companies to actually provide the data, think about the cost of research and development. How many years have activists fought for clarity, for transparency, or even on patents? There are so many data that we don't have. But again, governments and certainly donors of this type of efforts could maybe use their power, instead of giving money to a foundation to make an index, to actually put pressure companies and put regulations in place such that companies share these type of data. I think that those things could be maybe more interesting than just give a donation to a foundation to create an index based on voluntary sharing of data. And so I think that those governments and funders that support the index need to maybe think a little bit about how can they put pressure on companies to release the right type of data such that we can have a more relevant way of looking at what is going on.
Thanks, Elsa. And I think that relates to one comment, yeah, Gopa, in the about, you know, if the indicators were a little bit stronger or more critical, do you think companies would still participate and share the data? And without them participating, how could alternative assessments look like? So this really comes back to the issue of voluntary indices rather than assessments and evaluations of corporate conduct and behavior that are based on mandatory reporting, rather than being entirely dependent on voluntary submission. There's also, I think, an important comment from Tobias, who says that, you know, he thinks we're being very harsh on a positive initiative that's pushed companies to improve their behavior within the existing system, and that he sees this as an example of a tool that can be used to help internal change makers to make the case towards upper management that access initiatives should be expanded or that business practices should be reformed. And I guess part of our critique is that this is an initiative that is very limited to maintaining the existing system. It's kind of within the parameters of maintaining the existing system and trying to encourage better behavior to improve access to medicines. But you know, one of the things that's very explicit about the indicators is that these are indicators that are expected not to conflict with the fundamental corporate and business strategy of maximizing financial returns for shareholders. And I guess this comes back to the very important point you were making earlier, Els, about the financialization of the corporate sector and the way that transnational corporations are now, you know, the pattern of ownership and the way in which assets are managed by these big companies, asset holders like BlackRock and Vanguard, that have had the effect of making corporations become ever more aggressive and ever more focused on short-term profits. And that, you know, this is a structural problem that is not addressed by this particular index.
And if I may add something to that, I mean, the fact that we, even in the access community, talk about or think about specific initiatives that companies need to take to increase access to essential health technologies. I mean, it should be their main purpose. Like, what's the point of having pharmaceuticals if there is no access equitably from a public health perspective? I mean, this is why, I mean, medicines, vaccines, they are not ordinary commodities. We're not talking about televisions or cars here. And for me, like, just saying, well, we're already happy if a major company has an access initiative in Kenya or in Zambia or wherever, like, we shouldn't be needing to talk about those issues, because the goal of a pharmaceutical company should be to provide health technologies that are available, accessible for the population where and when needed. And this is where I think, and sorry, that may be a bit radical, but I think we went wrong in the 1980s, 90s, when we kind of left the initiative for public health needs-driven research and development and the manufacturing of these products to the private sector, that then has indeed become increasingly financialized. But we need to go back, like, the purpose. What's the purpose of a pharmaceutical company if not providing health technologies that improve the health of people globally? That should be their purpose. And we got completely derailed from that. And so I think we need to not pat them on the back for the few initiatives for access they do, but we need to really think back and say, like, how can we construct an ecosystem with public and private partners, but that actually deliver health technologies for equitable access? because otherwise there is no point, right?
Mhm. So I guess the question is how we balance the public interest need to improve access to medicines within a system that
Yeah.
is largely driven on the basis of market logic and financial incentives to generate surplus and profits. And I guess there will be people with different views about the role of capitalism in this sector and how that can be, a force to stimulate innovation and research and development for good. But one thing we haven't commented on was the experience during COVID. And that to me at least suggests that there is an imbalance in the power of public interest institutions and these transnational corporations in terms of being able to set appropriate pricing, in terms of being able to ensure that there is a balance between ensuring equitable access and enabling companies to generate a return on their investments, generate some level of profit. That really, to me, marks a very clear example of the scale of the imbalance between the public and the private interests in this sector, and suggests the need for some kind of systemic and structural change. And of course, also what we saw with COVID was the lack of transparency around pricing and around contracts between governments and pharmaceutical manufacturers. So that, this issue of transparency in data is one, I think, that is fundamental. I mean, I don't know what you think, Gopa, you work in this area. Can we construct a better index with the existing data that is currently available?
Yeah, definitely that's possible. Instead of looking at the policies of the companies, I think it's better to look at and independently assessment based on the realities, right? Like for example, take a cancer medicines launched by or any other medicine launched by these countries and the prices in various LMICs and when developing countries or LMICs, if you want to go that kind of categorization and see that what's on the ground, right? Rather than looking at the policy, policy can be on the paper, right? It may not be transformed on the ground. So I think we should look at the ground realities and say that, okay, these are the 5 products or 6 products launched by these companies, and these are the price. There is no price differentiation. Then that's for its access is affected, or if they have licensed, okay, look at the licensing agreement, whether they have anti-competitive conditions and whether the license really transform into access. So recently, we came across a license by Lenacapavir. The anti-diversion clauses make it virtually, impossible even for the, for a person to personal use exemptions. It's drastically or make it impossible to exercise the personal use exceptions. So normally, even if a medicine is not registered in a jurisdiction, you can still access that medicine under personal use exemption. And even patent law also allows, even though a patent that particular product is patented, still for a personal use you can still import a generic version or a medicine which is the same medicine which is priced at another jurisdiction at a lower price. You can still import. The anti-diversion clauses eliminate that possibilities, the kind of conditions. So these are the things I think we should look at much more, what's the real practices rather than the policies, and to cite an example. But having said this, I think there are 2 more comments in the chat. There are questions actually, if you can answer, that would be good.
Which ones are they, Gopa?
There is by Adrian, in addition to evaluating large pharmaceutical companies, the ATMF has also evaluated the role of SMEs and generics in the field of AMR, medical gas companies, diagnostics, and generic companies. Do you think the same criticism apply to these types of analysis? And another question is, okay, you finished this question, then there is one more question, maybe probably I'll read that also. I may have missed the early on it, but the index now align with at least existing human rights principles and policies. If not, might this be an avenue to shift the power, as Els correctly pointed out? These are the two comments. One is for Els and another is David can answer.
Let me answer the first one. So we haven't looked at the other indices, although we're currently doing an analysis of the access to nutrition index, and we will be publishing a report on that in the future. So there are many indices, as I mentioned earlier, and all of them require quite a lot of time and effort to actually understand the methodology and understand exactly how these composite scores are eventually produced. And what we tried to do with the Access to Medicines Index and the report that we've just published is to make it very easy for other people to look at the scoring system, to look at the indicators, and so that you can also form your own judgment as to whether you think these indicators are adequate, whether the standards by which we're holding the corporations to account are adequate and strong enough. We would encourage more debate and dialogue, and I'm sure that the Access to Medicines Foundation itself would welcome critiques and suggestions and recommendations for how it can strengthen and improve its index going forward. Els?
Yeah, and building upon that, I mean, integrating more some of the existing human rights principles and policies. I mean, there is clearly work that can be done to improve the indicators, but again, all the challenges of having the adequate data to actually assess those indicators will remain the same unless we find ways to actually have different access, that there are certain reporting requirements that are being demanded from the companies, and that's where some of the investor activism is trying to kind of, within the context of ESG, trying to set reporting requirements for companies that they need to report according to a number of supposedly more social parameters. But again, the question remains whether, as a theory of change, that kind of voluntary alignment and trying to score better on a number of things is a strong enough compulsion for companies, and it's also it's carrots without sticks and without punishments. And I think, to come back to what David was saying, I mean, tax behavior, for instance, or I mean, pollution or labor conditions. I mean, there are many different things that sit within corporate behaviors that one would need to look at a little bit more holistically in order to create pressures that don't come to just kind of like, let's do a charity proposal and a charity initiative to increase access to this or that drug in this or that country. That's never going to be good enough. And again, I don't want to be dismissive. Any increased access to a critical drug in any country is important. But we're talking here about whether mechanisms are sufficient to actually change the dynamics, that we don't have to fight for increased access for every drug by drug, country by country, because that is unsustainable. We want to actually support structural change. But there, I think we need to look at corporate behaviors much more broadly, because they are all aligned towards, as David was mentioning, the high financial pressures of investors and shareholders to maximize that short-term revenue. And so it's not just about what happens around access to medicines. It's about how a corporate behavior is actually currently incentivized in many ways that goes against the public interest. And I don't think that we can just look at one element. We need to look at them together. And it would be actually interesting to see corporate accountability indexes that look actually at general corporate behavior, because, I mean, we were mentioning the marketing practices of companies, including marketing of products that have shown to be harmful. We have talked about, or we have not talked about, but we could talk about the share buybacks that companies do to artificially create or keep their share prices high rather than investing in research and development. There are many different things that we can look upon that actually look at corporate behavior, whether it's aligned with the public interest or not, and that, I think, would be much stronger.
Yeah, maybe just one point to emphasize. Yeah, we're not saying at all that
I think one more question.
Hi, Gopa, we're losing you. We can't hear you.
I meant there is one more question at question. There's a question answer that.
Hi, Gopa, we've lost you. We couldn't hear your last comment.
Can you hear me now? Probably I'll shut down my. Can you hear me now? Yeah,
Yes.
There is one question by Malini in the question answer, so you can answer that also.
Can you repeat it, Gopa, because it's difficult to find. There are two series of questions, so I'm getting a bit lost.
I think Gopa's got problems with his internet. I'm not sure which question, Gopa, you're referring to from Malini. But I did just want to talk about, we're not talking about getting rid of pharmaceutical companies or trying to shut down the market in the pharmaceutical sector. In this report, what we are saying is that this index is probably not strong enough in terms of the standards that it set and in terms of what it is assessing. And because of that, it is possibly having an inadvertent effect in terms of helping to reinforce the power of these dominant transnational corporations, and possibly also diverting attention away from stronger regulation and mandatory systems of governance. So I think that's partly that's the main point that we're making in this report. We do also think, however, that there is an important need to look at how we finance research and development, and looking at other models for producing medicines and other products where there is a lack of financial demand. So we need to be thinking also about alternative systems of R&D, alternative systems of manufacturing to address the market failures that currently exist with the system as it's structured now. So that's something I think else maybe the independent expert group will be looking at.
Yeah, and just to notice that, or to note that there was a report commissioned by the Dutch government 2 years ago, I think, looking at the financial ecosystem behind research and development. And again, not specifically for low and middle income countries, just the whole pharmaceutical ecosystem, and where so this was commissioned to a private consultancy firm, so not a group that is suspected to be let's say, close to activists or etc. It was a business group that clearly, I mean, analyzed how today the choices of which drugs that get developed are purely based on financial calculations. There is no consideration of unmet health needs. It is purely based on which types of drugs, technologies will get us the highest return on investment. And I think it's a very sobering report to read. And then is the question, like, because that's where it starts, right? Everything, access is only relevant for the drugs and vaccines and technologies that have been developed. And so what will come out of the pipeline in 5 to 10 years down the line is whatever gets enough finance today based on these very, very strong financial return on investment criteria. So we really need to kind of find ways to move that back towards public interest. And I fully agree with you, David, that the only way in which we can get there is much stronger regulatory and policy framework that governments need to set in place.
Thanks, Els. Gopal, I don't know if your bandwidth is back on now, whether you're back live with us.
Yeah. There
Yeah,
are two
okay,
more
great.
questions. So one is that if International Court of Justice get involved in I don't know. I think it's not very relevant. I think we can. I think we that's not relevant to our topic. Something on.
Yeah.
So we can leave apart these things. If no other questions, I think we can conclude the webinar.
Yeah.
But I think one issue where I thought that this question may come: how do we get the data if pharmaceutical
It seems we lost Gopa again.
We've lost Gopal, yeah.
Yes.
filings in the various security exchange commissions around the world reveals a rich amount of data to do a reasonable assessment. And if anything is missing, the company can come and prove that, okay, hey, look, this is the information. So it's not a good argument to say that we need the cooperation of the companies, then only we can get the data, then only an assessment can be made. I think substantial amount of data to carry out such assessment is available in the public domain. So Malini has posted her question back. Is asking that is it problematic that the ATM index is primarily based on self-reporting by corporations? Is there performance from independent sources, media, civil society reports, etc., already considered?
Yeah, okay. Thanks, Gopa. We've lost you again, but just to respond quickly to Malini's question, I think that there is a problem, I think, more in the sense that it's very difficult to know what the final data set is that produces the eventual scores. So data is provided by the companies. Apparently, this data is verified and checked, and that there are also independent sources of data that are used, but we cannot actually see what the eventual data set is that is used to produce the scores and the index. So that is the problem. There probably is enough data available to construct a stronger index and measure a performance, but there are also clearly issues around a lack of data to be able to adequately and effectively hold some dimensions of corporate conduct and behavior accountable. And you know, there's also methodological challenges about how you can assess certain forms of behavior that effectively happen behind closed doors. So we know that there is a lot of political lobbying that is done, which may contradict the public statements that corporations make. And it's very difficult, if not impossible, to be able to actually collect that data itself. So there are issues, I think, around data and how we can adequately and effectively monitor and assess corporate conduct and behavior.
I think,
If I
David,
may
you have
add,
answered all the. There are 3 questions by Mile.
Yeah. Else?
Yeah, just one addition I wanted to highlight. I think that, of course, nobody is expecting that an index in and of itself, as a standalone, is very influential. The question is like how to connect those type of indexes, even improved ones, to actual action, and there is the how can actually those assessments provide enough documentation for policymakers to realize like, oops, maybe we need to step in here because it's not going to happen by itself. I think we know that those behaviors are not often voluntarily improved in a significant way unless they coincide accidentally with increasing short-term financial returns. But I think the importance to kind of document that, and maybe there is more work that needs to be done to actually then, based on that, influence different policymakers, different policymaking forums to actually act upon what we've learned from those measurements. And I'm not sure that this is explicitly happening today. I think there is an idea, well, we'll put it in the public domain and then change will happen. Maybe it really needs, and we all know, those of us that are into advocacy, policy change takes very dedicated advocacy strategies. It doesn't just come falling out of the sky.
Thanks, Els. Gopa,
Yeah, I'm here. I think I don't see any more questions. Sorry for today. The connection was a bit problematic. So I don't see any further questions or either in the question answer or in the chat. Then sort of we can conclude the webinar. So anybody has either David or else has any last comments on as a concluding comment, and then we can conclude it.
just to thank everyone for attending, to encourage people to actually read the report and to please continue to communicate with us about your comments about the indicators, and also just give us your views, if you can, about whether you think our critique was too harsh or not too harsh. It's always good to get some feedback. Thank you.
Else?
Nothing to add. Thank you for everybody's attention. And yeah, this is work in progress. So engage on it. That's what we're trying to do.
I think it's a good idea, David, to send the link of the report to all people who registered for this webinar, so they would be able to access the report on their desktop or their devices and then read it and comment, send us the comments. So thank you once again. Thank you for all the participants for your patience and for taking time to attend this. And thank you for all the speakers. So once again, and all the people who work behind this, behind the scenes, your colleagues. So thank you. So let's conclude the webinar.
Thank you.
Okay.
Bye-bye.
Thanks. Thank you. Bye.
Bye.